Managing tantrums, especially in children, though this can also be relevant for adults with certain emotional regulation challenges. Managing tantrums is a complex task that requires both understanding the underlying causes and employing strategic responses. Here's a bite-sized overview of tantrum management, broken down into causes, strategies, pitfalls, and recommendations. Understanding tantrums, roots, and triggers. Developmental factors. Tantrums are most common between ages 1 to 4, as emotional regulation, language, and impulse control are still developing. This is due to neurological immaturity. Young children have underdeveloped prefrontal cortexes, meaning they struggle to manage big emotions. Communication gaps often result in frustration, which often stems from not being able to express their needs or desires. Psychosocial triggers can consist of examples such as hunger, tiredness, overstimulation, frustration from perceived blocked goals, the need for autonomy where they wish to assert independence, for example, I want to do it myself. There can also be an element of attention-seeking behaviour. Goals of tantrum management. In tantrum management, immediate de-escalation of emotional intensity is a core goal. The safe person needs to engage in modeling and teaching emotional regulation while maintaining connection while setting boundaries. Preventing future outbursts through long-term strategies is of significant importance. Critical strategies for managing tantrums. Before the tantrum, prevention is key. Routine and predictability helps children feel secure and reduces anxiety. Emotional coaching, teaching names for feelings increases emotional literacy. Yes space, creating environments where kids can safely explore autonomy. An example would be, instead of saying don't touch that, say, you can touch this instead. It is imperative that during the tantrum you stay calm and regulated. The aim is co-regulation, not control. You can do this by get down to eye level, use a calm tone, say minimal, validating words such as you're really upset. I'm here. During a tantrum don't try to reason, logic won't work during an emotional flood. Wait for calm before discussing. Set clear and consistent boundaries. For example, I won't let you hit, while gently blocking the action. Remove audience if necessary. Sometimes removing attention can diffuse the situation, but avoid shaming. After the tantrum, your next goal is to repair and reflect. Reconnect emotionally, a hug, eye contact, presence. Name the emotion, you were really mad when we had to leave the park. Teach coping skills, deep breaths, squeezing a pillow, using words. Common pitfalls in tantrum management. The common pitfalls people fall into when trying to manage a tantrum can include reacting emotionally, yelling, threatening, which results in escalates the situation, and models poor regulation. Giving in to demands, which results in reinforces tantrums as a tool for manipulation. Punitive responses, for example, timeouts without context, which results in a breaks connection, and fosters shame or defiance. Over-verbalizing during meltdown, which results in an overwhelmed child, which further delays de-escalation. Cultural and contextual considerations. Cultural norms shape expectations around obedience and emotional expression. In some cultures, emotional suppression is valued, while in others, emotional exploration is encouraged. Parenting style, authoritative versus authoritarian versus permissive, affects how tantrums are perceived and addressed. Special considerations. For children with neurodivergence, for example, ADHD, autism. Remember that meltdowns are not tantrums, meltdowns are neurological and not behaviorally driven. In the event of a meltdown, use sensory strategies, visual schedules, and low stimulation environments. For adults, for example, those with emotional dysregulation, trauma, or other psychological issues. Tantrum-like behaviors may stem from poor emotional coping skills, unresolved trauma, or personality disorders. In this is the case, effective interventions might include dialectical behavior therapy, DBT, mindfulness training, or attachment-based talk therapies. Summary recommendations. Key recommendations for dealing with a tantrum include stay calm and empathetic, set firm but loving limits, Reflect and teach afterward and adjust environment/routine to either reduce the chance or it happening again or to remove a trigger. Avoid engaging in yelling, shaming, or ridicule. Do not give in to tantrum-driven demands, never ignore the opportunity to build skills, and never assume the child is being manipulative or bad. Final thought. Managing tantrums isn't about control, it's about connection, regulation, and guidance. The caregiver's own ability to stay emotionally regulated is the most powerful tool. Tantrums are not signs of failure, they are opportunities for emotional growth, for both the child and the adult.